Hello students, welcome to Legacy IAS Academy. Today we are going to discuss about a virus which has been making the news headline for past few weeks, or even you can say past few months, especially in the region of Africa. The virus popularly is being referred as bleeding eye virus because the symptoms of this virus results in the blood gushing out from the eyes, ears, nose, and how deadly this virus is and where it has spread and overall origin and history of this particular virus. That is what we are trying to understand in this particular video of today. Now, to give you the brief context that why this particular virus was in news, so very recently WHO, that is the World Health Organization, it has stated that they have begun a 42-day countdown to declare the region of Rwanda. Rwanda, we'll discuss later, is a country in Africa where the viral outbreak was reported. So, to declare MVD outbreak over, they have started the 42-day count line, and this this countdown will keep on going unless and until no new cases are registered. If for 42 days no new cases are registered, that means the viral outbreak can be considered to be over as far as the WHO is concerned. Now, since the East African country reported the first Marburg case late last month, at least 66 individuals have been infected so far, and the fatality rate, we can understand how high it is, that 15 Marburg deaths have been reported. So if you calculate 15 by 66, that means almost 40% of fatality, we can understand that the virus has caused. Now, about 80% of infections also are among the medical workers. The reason behind this we'll discuss in the later part of the slide, that why medical workers are at high or more prone to basically catching this particular virus. If we talk about the Rwanda, where the outbreak was seen in the year 2024, only 1500 doctors are present that cater to a population of over 13 million. So what we can understand is that the fatality were much more higher in Rwanda because of the crumbling healthcare infrastructure or inadequate healthcare infrastructure, and the such kind of outbreak of the viral diseases threatens significantly and causes strain on the healthcare system of such countries. So this is something that we can also consider as a lesson for India if such kind of outbreak happens in our country as well. Now, if you try to understand about the bleeding eye virus, the actual name of this virus is MVD, that is the Marburg viral disease. Why Marburg? Now, if you look here, the first time when we have a record of such viral outbreak, it was recorded in the region called as Marburg in year 1967. Marburg, as you can see, is the region in Germany. Apart from Marburg, we also have the cases here in the Frankfurt region of Germany. So total almost 31 cases were observed in 1967, and at the same time in the same year, in one of the East European countries of Serbia, the capital of which Belgrade we have, is also the Marburg viral outbreak has happened. That is how we can trace the origin, and since it was the Marburg region where first the viral outbreak has happened, the disease is referred as Marburg viral disease. Why bleeding eye disease? Because obviously we have discussed the symptom is blood gushing out from the eye, so bleeding eye disease. Now, if you look at the recent cases of such viral outbreak before the recent year in Rwanda, in the year 1998-2000, you have the region of DRC, that is the Democratic Republic of Congo, a country in Africa, central part of Africa, as you can see from the map here. So many areas of DRC has witnessed such outbreak. Then in 2014-17, you have Uganda region that was affected. Before that, you have the Nairobi, that is the capital city of Kenya, that is where the outbreak has happened. Then more recently in 2005, the outbreak happened in the Ulge region, that is in Angola, which is a West African country. Then further in South Africa, also in 1975, if you look, we have the outbreak in the Johannesburg region. So after 1967, as you can see, most of these viral disease outbreak has occurred in the regions of Africa, spanning to the eastern coast, western coast, central region, southern region. Entire region of Africa, we can say, has been affected. And more recently, if we talk about in 2021, Equatorial Guinea, a country on the western coast of Africa, also observed this outbreak. Then you have the Ghana, that is Asante region of Ghana in 2022, where the outbreak has happened. And more recent, that the outbreak that we are talking about is something that has happened in the region of what we can call as Rwanda. And before that, we have another country called as Tanzania, or officially referred as United Republic of Tanzania, where this viral outbreak has been recorded. So this happened in year 2023. This happened in year 2024. So now let us try to understand about this disease in more detail. So if you look at the MVD or Marburg viral disease, it belongs to a virus family called as Flovirida. Now Flovirida is also the same family from where you have the origin of another virus that also keeps on what can call as infecting or spreading in the African nations. You might have heard about is Ebola. So both Ebola and Marburg belong to the same Filoviridae family. Filoviridae basically can be translated to such kind of virus which causes viral hemorrhagic fever. Viral, that refer to virus related. Hemorrhagic means where you have the massive blood loss, and fever is obviously referring to the high temperature of the body. That is the first and the earliest system of the infection in this case. Now, the region behind the recent outbreak, or the before that, if we talk about the outbreak in Uganda, is related to the import of African green monkeys or their tissues. So if you go back to this part, as you can see, we have in this region, we talk about Uganda. Uganda is in this part of Africa. So in 2017 and 2014, 2 years are where you have the outbreak of this disease, and that was related to what? Importing of a tissue related to the green monkey, as it is called. And incidentally, if you talk about the initial cases that we recorded in Serbia and Germany, there also the reason behind the spread of the virus was because the medical workers, they came in contact with the tissue of this same monkey, that is a green monkey from Africa. So this is the major primate, we can say, which has been responsible for the outbreak of Marburg diseases in different regions of Africa, and initially in the case of Europe as well. If we try to understand the overall transmission of this virus, so generally the pathway is considered to be the bats, which are the natural host or reservoir of this particular virus, and from these bats the virus is transmitted to the primates such as chimpanzees, gorillas, monkeys, and then from the monkeys, chimpanzees, gorilla, the virus is transmitted to the humans. So let us try to understand one example of how the transmission can happen. Now, if you look here, the bats, as we have discussed, they are the natural reservoir or host of this virus. So, when bat come in contact with the chimpanzees, for example, either chimpanzee and the bat, since they are living in the same forest area, the waste product of the waste product of bats can come in contact with chimpanzees, or chimpanzee can try to kill the bats, or bats can even bite the chimpanzees. So, after the bite, chimpanzees get infected or monkeys get infected. And now the possibility of transmission to the human is by two pathways. First is, like, if suppose if we talk about monkeys, now in the case of Africa, the hunting as well as the consumption of monkeys for eating purposes as a delicacy is very common. So obviously if you hunt infected monkeys, you will come in contact with the bodily fluid of that monkey, and the human transmission to human is then recorded. Or other direct pathways you have, if you come in direct contact with the bats themselves, if you talk about the fluids of the bat or the blood of the bat, if you're walking in the forest areas, so that also is how you can get the virus. Now once the virus has entered the human population, from human to human transmission can happen at a rapid pace, because if a human come in contact with the blood, any kind of body fluids, all the waste material of the infected human, that other human can also get this particular disease. So that is what we have talked about, as the Marburg belong to Filoviridae. So it is a type of filovirus, and that is how the transmission of filovirus can be observed from animals to human, and that is why it is also referred as example of zoonotic disease. Zoonotic is a term used for referring to such diseases which transmits from animal population to human population. So if we talk about the spread of infection, same thing we can say, that it spreads among humans by either direct contact with the bodily fluids of the infected bats, or surfaces contaminated with fluids. Even in many cases, if suppose a person infected with this virus is admitted to the hospital, now obviously as we have discussed, one of the major symptoms of this virus is release of the blood and all that, or bloodly fluids are there that is being released from this person. So the bedsheets and clothes will get infected. And if we talk about the sanitary practices at the hospital are weak or lacking, that is generally the case in developing countries, especially poor countries of Africa, then there is a high chance that another patient who might be admitted to the same hospital, maybe for some other minor ailments, not even this particular disease, can easily get infected because coming in contact with the infected person. Disease can also spread during burial ceremonies if there is a direct contact with the body of the deceased as well. So there are various ways how the infection basically can be transmitted. That is what makes this virus very deadly in nature. But the most deadliest part of this virus, or the aspect of this virus, is the fatality. The fatality rate is very high. So once suppose a person gets infected with this virus, the incubation period lasts somewhere between 2 to 21 days. Incubation period refers to that period where the virus is continuously multiplying inside the human body. The symptoms are not clearly visible or are visible in their original form. It is between the 2 to 25 days when a sufficient replication of the virus has happened in body. That is when the body's system or organs, tissues began to get severely infected. Average fatality rate, if we talk about, is almost 50%. And the initial symptoms are high fever, more than 102 degrees Celsius, severe headache is recorded, and general bodily discomfort that has been recorded. And after a few days, between, we can say, 7 to 9 days after the infection has occurred, a person start to show a very severe symptoms, which is largely symptoms of hemorrhage, where the blood start to come out from all different parts of body, such as eyes, ears, you have nose, etc. And this causes severe blood loss. The severe blood loss then causes shock in the organ system of the body, as tissues and the organs of body cannot get enough oxygen, because as we know, blood is responsible for carrying out oxygen throughout the entire system, and that causes multiple organ failures, which ultimately results in the death of the particular infected individual. So that is how we can understand the deadly nature of this virus. Now if you look at the available treatment, or if we talk about testing of this virus, so for testing you have two general methods. One is the ELISA testing method, other is the RT-PCR method, the same method that almost all of us are aware about. When the COVID-19 outbreak happened, I think almost all of us have undertaken this RT-PCR test. So same test is conducted for the Marburg virus as well. Apart from that, ELISA testing is also done here. As far as the treatment is concerned, as of now, as per WHO is concerned, there is no authorized vaccines or drugs for this particular virus. The only solution or treatment that we have is, because the disease causes massive loss of fluids, there need to be a rehydration with oral or intravenous fluids to the infected individual. Treatment of specific symptoms is largely done by the doctors or medical professionals here. What it means that, for example, we have discussed one of the symptoms is headache. So for headache, you have the pills that can be given, or you have high fever. So for that, you have the paracetamol, Calpol, and all these medicines can be given. And you have intravenous fluid, ORS, all these things can be given. So treatment of a specific symptoms is the only way that can improve the chances of survival of infected individual. So that is what we can understand about the treatment and testing of the Marburg virus disease. Now the question comes that only in 1967 we saw the outbreak of this disease in Europe. After that, we have not seen the outbreak of diseases in North America or Europe. What is the reason behind this? Why the continents of Africa and Asia are largely prone to such kind of viral disease outbreak? Now the answer here can be given on the basis of three factors. First of all, we know that as far as our climate is concerned, the equatorial and tropical regions of the world receives heaviest amount of rainfall, and also they are the region which receives highest sunlight. That is why temperature is high, rainfall is high. So in such hot, humid condition, or hot and moist condition, what has happened? You have development of large green forests, okay, or evergreen forest, and the forest cover of this region is very humongous. And if the forest cover is very humongous, there will be animal population who will be residing inside it, and these result into a higher probability of contact between the human animals or man animal. And obviously, as we have discussed, these are the zoonotic diseases. So higher the probability of contact between man and animal, higher will the chances that you will get infected by the disease. Second, there is a dramatic transformative changes that is happening over these continents, where you have urbanization that has began to take place. Urbanization has resulted in the deforestation, cutting down of forest, due to which large number of these animals which earlier used to reside in the interior of the forest, now they are coming outside of the forest, they are intermingling with the human settlements or continuously interacting, coming in the human settlements. That also has increased the chances of contact with the animals. And dense forest here and the culture of consuming wildlife also we can say. If we talk about China, we talk about the continents of Africa, many such countries are there where wildlife such as bats, monkeys are consumed as a delicacy, as a food item. And obviously if you consume an infected organism, the chances of infection will be very high. Not only even for food, even many medicines are there that are prepared using the parts of these organisms, these animals, that also increases the risk of infection. So that is why Asia and Africa are a hotspot for these kind of disease outbreak. Now, in conclusion, what we can say is a statement that has been given by the WHO, where they have said that the only way how we can tackle such outbreaks is following one health approach. One health approach in simple term means that we have to stop thinking of humans, animals, and what we can call as the environment as a separate entity. Generally, what is happening? There is a continuous interaction and interdependency that has built up between the human, environment, and animals. And if you want to have an approach to tackle such diseases, we need to consider them in an integrated manner, as all of them are linked together. And WHO Director General Tedros Adhanom Ghebreyesus, he has said that we cannot protect human health without considering the impact of human activities that disrupt ecosystems, encroach on the habitats, and further drive climate change. And that is how we should focus upon, that is what we should focus upon if we want to make sure that such disease outbreaks does not happen in the future, or the severity of such outbreaks can be minimized. So that is all about this particular video. I hope you understood overall that what is the Marburg virus disease or the bleeding eye virus disease, and what are the reasons why it was recently in news. That is all for this particular video. Thank you very much.